Hey, I'm Zeb,
And I'm Maddie.
and welcome to the We Don't Know Yet podcast. Whilst both Maddie and I are healthcare practitioners, we understand that there's no one-size-fits-all approach to healthcare. Should you require any medical attention, please seek out your local healthcare practitioner.
Hello, hello.
How are we doing?
Good. How are you?
Thank you.
First guest
I
appearance.
know, I'm actually a bit nervous. I'm like, what am I going to ask him, even though I talk to you multiple times a week?
every week.
Yeah, and we have a running thing on this show, mate. You're not allowed to say the word suppose.
Oh, yeah, Zeb's got
Now
a
that
little
you
bit
know,
of a suppose
it's a slippery
counter.
slope.
Right, I don't think I say it all that often, but now
Good.
that you've brought it up.
Yeah.
Oh,
I know.
it's so funny. Our editing team did a little reel and they counted the amount of times Zeb said
no.
suppose in a podcast.
Yeah,
It was
right.
very funny.
It was
Good
at
to
like
know.
15.
It was ridiculous. I guess
I
for
know.
our lovely listeners, can you introduce yourself and share us a little bit about, who you are and what you do?
Yeah, so my name's Mick or Michael Chapman, depending on where people know me from. Mick's usually, in the sporting realm, and Michael's a bit more professional, obviously. I grew up in Tamworth, grew up in the country in New South Wales. So
Wow.
sport was kind of second nature. And then the way that I kind of migrated into university was that I always wanted something to do with the human body and what we're capable of doing. So that's why I chose nutrition to go through university with. And after university, after my undergrad, I just saw I didn't really want to be clinical as a dietitian. I just found it very
Prescriptive.
yeah, and very individual in terms of only helping out one person at one time. And I know that's not the case, but that was my perspective at the time. So I diverted into a Masters of Public Health, which wasn't that big back then and seems to be now. But loved it, completely loved it. And then, just graduated in 2012 and, I've been working in the health system in one way or another ever since, yeah.
Yeah, wow. I had no idea you were from Tamworth. That's so cool.
Yeah.
When did
Country
you
boy.
move to Sid?
Yeah. I moved to Wollongong actually to do uni. So I was living there for
makes
10
sense.
years. Went and lived in Vancouver in Canada for 2 years.
Yeah, wow.
Cycled across America and then came back here with no money in my back pockets.
I love that. It's always
Good.
very humbling when you have $0 to your name.
Yeah, that's when you learn the most about yourself, I feel.
It's so
the
good.
dream.
Yeah. Dream.
100%. When I came back from Europe, I think I had $4 to my name. I was like, this is an all-time low, but I
Yeah,
wouldn't
it
change
was
it
worth
for the
it.
world. Yeah.
Yeah.
We'd like to take a break from today's episode to give a quick shout out to our sponsors, Drip Digital. They manage all of our audio and video editing as well as our social media marketing. Without them, the We Don't Know Yet podcast wouldn't be possible. So thank you again.
And give us a little bit of an intro into kind of how we came across you, mate, because I feel like we can't go without mentioning URC.
100%. Shout
Yeah.
out to
It
URC.
had to jump in there. Talk
Yeah.
us through a little bit about your almost said it
Yeah.
running adventure as well, because
Yeah.
For those that are
you're a
listening,
pretty avid
Chaco's
runner.
100%. Athlete, some might say.
Yeah, as I said, grew up in Tamworth where sport was just like second nature.
Yeah.
Had an older brother, so literally everything was competitive. And I love the competition, so I've always grown up that way.
Yeah.
But running, triathlon, touch footy, rugby union, they were my main sports back in school.
Yeah, man, rugby's such a New South Wales sport, isn't it?
Yeah, it is. It
Definitely.
is.
I've been converted. I'm enjoying a little bit of rugby league at
Well,
the minute. Go
yeah,
to Sharkies.
go to
Watched the
Sharkies.
game last night.
Yeah, we lost.
Yeah. I mean, they didn't deserve to go on, but neither did the Roosters, so
No.
they're going to get pumped next game, I
Yeah.
dare say.
Definitely.
Yeah.
But yeah, so grew up playing bit of everything, but every sport demands a different kind of body type, I guess, and,
Yeah.
and trying to be big enough for rugby, but also small enough to be quick in
Like touch.
triathlon and things like that was tricky. So that's when I was kind of thriving in triathlon in the later stages of school, and then I've just always been running, and suddenly in the last probably 5 years, and COVID's definitely helped with that, is running's become cool all of a sudden.
Yeah. Oh, it's so trendy.
Yeah, so it's
Get your Nike whatevers
yeah,
and
yeah.
your Asics
So-
and yeah.
but it's it's good. People are getting out there and learning about like their body and how enjoyable it is just to get outside in nature and
push
put a
it to
pair
the
of shoes,
limits.
put a pair of shoes on and get out there. So
Yeah.
yeah, I've always been running, but obviously like-minded people come together like we are right now. But I've known WAGs for quite some time through the touch community, and then just kind of migrated more and more into the URC and what he's doing with it. So it's a great community.
Yeah, it's awesome.
absolutely.
You're definitely like a fundamental member of the URC. I think you were the one that actually got me there.
Oh yeah,
Yeah,
there you
because Chap and I were kind of like internet colleague friend things in the nutrition space, and he was seeing that I was running, I think, and you were like, "Oh, just come to URC one day," and
there you
never
go.
looked back.
I didn't even know that.
Yeah.
And it's such a cool community as well. Like, I remember moving up here not knowing anyone, and Wags was happy to just jump on the phone, chew my ear off for a couple of minutes and be like, yeah, mate, come on down. Like, if you're wanting to just give it a crack. Mind you, I'm a basketballer, so long distance running was not my thing to start.
To be fair, you have absolutely smashed it.
Yeah.
You change pretty quickly once you stop running up and down a basketball court and running, you know, 20-something Ks.
Yeah, definitely.
Yeah, awesome. So running, a little bit about your history with public health. I guess where has that, I should say, led you today? Like, what do you do?
So I was lucky enough that I've come through kind of different spaces in the health sphere. So worked in the research in a research area as soon as I got out of university. So I actually was lucky enough to get my name on 4 papers as soon as I left university.
Oh, wow.
Which was cool. And that was
Super
all
cool.
around kind of behaviour change and public health principles.
Yep.
And then moved into like NGOs, non-government organisations, worked across the NDIS when it first came around, and that was quite fascinating.
Yeah, awesome.
And I was just saying to Zeb before that it's the biggest change in the Australian healthcare system since Medicare.
Well, I actually didn't realise how new it was until I
Yeah.
started working in that space. It's insane.
Yeah, so, and I mean there's teething issues with it still, but
Yes.
it's the same as any large national kind of
Organisation.
health, health scheme. And then made my way into New South Wales Health, where I've been for the last 5 years, and worked across different things, and anywhere from the school canteen strategy back in 2019 through to COVID contact tracing, and then more recently kind of the COVID policy, so writing policy around when outbreaks happen in an early childcare centre or an aged care centre or a jail or prison. So that was really fascinating, having conversations to say that this person's allowed to be out on bail legally as an individual,
Really?
but also from a public health perspective, how do we then protect the rest of the community so that they're not infecting other people as a COVID positive case. So there was conversations that have never been had in the healthcare system before, and it was just really fascinating to be a part of that.
Yeah,
and as well,
very cool.
I think it was like such a new space too, right? So like it was unknown. Like I remember being in Melbourne during the lockdowns, and it was kind of like everyone's trying to throw in these strategies, and no one knows what the hell is going to be the outcome. And you know,
Honestly.
like you said, like these conversations are just things that like everyday people like us, you just don't think about it.
Yeah.
You know? But it directly impacts the lives of those who are actually in those situations, right?
Yeah. Yeah. And the Public Health Act, even though, you know, there's different debates or discussions that can be had around that, but the Public Health Act is one of the largest or most influential that we have. And it's like that whatever your individual right is, it doesn't come before the health and well-being of the community itself.
Okay.
So we need to look after the community, and
Yes.
so there's certain things, and that's why there was certain laws and fines and things. And I mean, they got rid of a lot of the fines in the end, which is I fully agree with.
Yeah.
Shouldn't have been fining, but like fines don't necessarily deter behaviour.
No.
But I mean, it was a fascinating space. I'm glad that that's finished now. I'm glad I got
Yeah, I bet.
experience there, but now I'm back working where I should be and want to be, and that's in
Yep.
the public health space. So I'm a health promotion officer with the Sydney Children's Hospital Network now.
Awesome.
And so that's still under the New South Wales Health umbrella, but do a lot in terms of paediatric kids' health.
Yeah, that's awesome. And it would be it definitely is such an important area, because obviously growing population, you want to start from an early age. Definitely didn't do that explanation justice.
Yeah. No, I think I I always say that healthy kids become healthy adults.
Yes.
And I mean, we can get into this, I'm sure, at a later stage in terms of the healthcare system, but we've got an aging population.
Yeah.
And when these kids are our age, there's going to be a lot of emphasis on an older age group
Yes.
that are not necessarily in the workforce anymore, but will need a lot of funding, resources put towards them
Yep.
in order to keep them healthier for longer.
Yeah, right.
So it's a tricky space,
Yeah.
and there's obviously a lot of moving parts, but yeah, I mean, the Australian healthcare system isn't perfect, but
Yeah.
we've got an okay one at the moment. There does need to be some changes.
Yeah, well, I was actually having a conversation with like Beck, one of our friends from Canada, and definitely I completely agree. Like, there's a lot of flaws in our healthcare system, but compared to other countries, we actually do have it pretty good. Well, that's my understanding of it anyway.
Yeah, I mean, the easy way to look at it is on a sliding scale between somewhere like America, where
Yeah.
there's a lot of onus on the individual,
Mm.
and if you're not educated, have enough money to be in a workplace where your health insurance is tied to your job,
Yep.
then you lose out, and then you're starting to kind of almost like barter with doctors around giving healthcare for a certain price that you can actually afford, which
Yeah.
is what we had in Australia before 1984, which is when Bob Hawke brought in Medicare.
Yep.
And Medicare changed Australian healthcare, and that's our public health system
Yep.
and universal health system, which is has been a great system.
Yes.
But then when you go towards the more like government funded healthcare systems like you see in kind of the north of Europe,
Yep.
when you do have an aging population and a lot of your taxes are tied up with healthcare, education and things like that, there are major issues when there's a huge percentage of people that are not in the workforce but need that resource and funding.
Yeah.
But there's not as many people actually paying those taxes to actually go towards that.
Right. Gotcha. Yeah.
So
yeah.
we kind of sit somewhere in the middle there.
Yep.
But in saying that, the the Medicare system does need to change. That's our public health or a universal health care system.
Yep.
At the moment, it still focuses on chronic health conditions that require pretty much hospitalisation. We're trying to get people who are sick back to regular health,
Get them back.
rather than preventative health, which I think the healthcare budget is 2% of the healthcare budget is for preventative health measures.
Are you serious?
Which is wild.
And it's crazy, isn't it? Because like this is where today's discussion kind of leads, right? Like was half the reason for us to kind of sit down and chat with you. Is it's pretty wild that that's the case, and you look at, in general, at our health literacy across Australia, and it's pretty
Varied.
poor.
Yeah.
Like a lot of people have differing experiences. Education plays such a role in that, and I think as well, just like those initiatives that you're talking about in terms of things that are put in place or strategies that are put in place to actually promote health and talk to people about their health. You know, there's just none of it out there, and it blows my mind.
Yeah. Yeah, there's a lot that happens in the background in terms of policies and guidelines and things like that
Yep.
probably lay people don't see.
Yeah.
But it does come down to that education, that health education side of things. And I mean, we always talk about schools, and the school curriculum is too flooded at the moment. But
Yeah.
and we shouldn't just rely on our teachers as parents. We need to be good role models and teach our kids certain ways. But as a parent, if you don't know that, how are you meant to teach your kid?
Exactly.
And so I think that's when people start to potentially rely on online forms and things like that, and
Yeah.
suddenly you're in this deep dive hole of my kid
Misinformation.
needs to have keto, or we're all going to die.
Oh,
Yeah.
don't get me started.
Yeah. So, and I mean, you look back in Australian history, we've had some great public health campaigns, like the Slip Slop Slap campaign. I don't know if you guys would remember Life Be In It. It started in the 70s, and I think they rebooted it. It's just about getting out, being active,
Yeah, cool.
getting off the couch.
Actually, don't remember that one.
Yeah.
But Slip Slop Slap is
So-
like
so-
ingrained into
yeah,
my brain.
As a child, I feel like if you don't know
Yeah.
what that means, it's like you missed out on something
were you?
pivotal.
Yeah.
And then just things like plain packaging on cigarettes have made a huge difference. So small policy changes can make huge impacts on individuals' lives. And for everyone that that goes on about, I don't know, different conspiracy theories about the government's controlling us and things like that. There are plenty of flaws in the government system, whether it's state or national. I'm not here to defend that by any means.
This is not a political podcast.
Not at all, not at all. But in saying that, there are some great campaigns that are out there that exist for the sole purpose of getting people healthier, that are free, accessible, things like that. But again, there's still issues with that.
And I think it comes back to what like we were talking about before, right? Like there seems to be this reliance. It's like they need to fix us, or you need to fix us, or you need to put something in place to fix us. Like everyone can only do so much in this scenario. Like I think we're at a stage now where, as a community and as a country and as a world, we all probably really need to take a little bit of independence and initiative and start putting our own kind of health in our own backyard instead of relying on, your healthcare practitioner to pull you up as it is. As healthcare practitioners, like sometimes you get 30 minutes with a patient, and that's all you get. You don't, that's it for the week. And
you hope to God they retain at least one thing that you've said.
And it is really tricky to convey a lot of those messages. Relating that into public health. Then it's like, the government can only chase a certain amount of channels, and a lot of the time, like you said, they do a pretty good job. There are definitely some things that in the background that they probably need to work on, and some other things that they're not covering as well. But
overall, and I feel like you're never going to keep everyone 100% happy.
No, but as you said, there's two ways to look at it, and the best case scenario is when large government organisations, local community groups and individuals are all working together for the same cause. And sometimes that happens, and it's great when it does. But there's what's called a top-down approach, which is like a organisation saying you're going to do this because we told you to do it. And then there's a ground-up approach, which has way more impact once it's done properly. And that is a community or a set of individuals saying, hey, we want to do this and we want to drive this, whether it's, a new kids soccer team and making, trying to get that comp started in a local area, all of those sorts of things. That's a ground up approach. And when we have a ground up approach with government support or funding, it's so useful.
I can imagine like the motivation to make those behavior changes would be a lot higher in that ground up. Rather than someone just telling you what to do.
100%. And we've learned time and time again that telling people what to do doesn't work. You need to work with communities and stakeholders in order to implement things. And I forget the name of this book. There's a great book that talks about this guy that was this guru in public health that went over to this African community and said, here's a perfect riverbed and it's very fertile on each side. Just plant your veggies along there. They'll grow. Eat those veggies. And the community was like, okay, cool, whatever. We'll have to listen to this guy. Instead of so there was no discussion, right? He flew home, flew back to the community 6 months later, and all of the veggies were gone. He said, oh, well, what happened here? Like, I told you exactly what to do. He said, oh, well, we've got hippos that run through these rivers. They come up and they eat everything. And so a simple conversation would have been like, well, there's like planting something beside that riverbed is not an option. So that's a prime example of chatting to community and saying what works for you and bringing in that expertise to say, like, let's work this through
collaboratively
rather than just saying, I'm the expert here. This is exactly what you do. And I think for any allied health professional, there's a lesson to take from that to meet people where they are on their journey.
Absolutely.
And not just say, well, I'm the expert here. This is what the research says. Like, implement this or go away.
No, definitely.
It is really hard. I think like especially when I came into the workplace, I was kind of thinking everyone that comes to see me is going to be so motivated. They're going to want to get better. That's why they're coming to see me. But you're right. It doesn't always work
my
like
GP
that.
sent me here.
I'm only here because my wife booked me in. Like, it is really tricky to find that balance between meeting them where they are currently and trying to have a strategy in place for them to actually take little steps to get towards where they actually want to be.
Yeah, even more to that as well, like with the sort of eating disorder space. I went to a conference the other week, and basically the whole main takeaway point was that they need, or we need, I should say, more sort of opinions and experience from people with lived experience in the industry or in the workforce.
Yeah.
I guess I imagine that would be similar to your approach or that approach.
Yeah, exactly. And it's I think as healthcare professionals, we can't just go, oh well, I've got the magic pill, and listen to me because I'm the best.
Yeah.
You've got to say that this person might not be ready to make a change. They're coming to me.
Yeah.
I have an opportunity here for half an hour or an hour
Yeah.
to try and figure out where they're up to and potentially make some small change.
Yeah.
And it's better to make a small change than flood this person with information
Exactly.
and them leave and go, well, that's
What the
not my
fuck?
person. I shouldn't be there.
Yeah.
Blah blah blah. So it's much easier to try and and I guess it comes with experience when you go, okay, I know this policy, I know this guideline, I know kind of where everything comes in and feeds into, and then I'm trying to figure out where this person sits in this whole process and how I can help with all the knowledge that I have behind me to actually feed that into this person.
Yeah. I've got one question for you, but I'm conscious that it's going to head down a rabbit hole. So if it's too complex,
That's so
just
good. Let's
cut
do
me
it.
off.
Let's do it.
We always knew there was going to be a rabbit hole today
I
at
know.
some stage.
As you're talking, my brain's just like lighting up with ideas. But I guess I'm really interested to hear if you've had much experience working with like Indigenous populations throughout your career, because I feel like from a public health perspective, that would be massive, right?
Huge. Yeah, so huge. They have always been, since I've been working, they have always been a priority population group. But this is probably the prime example of exactly. And trying to get Indigenous Australians to fit a white Australian or a Anglo-Saxon Australian way of life, where we think, success is earning over $100,000 a year, and success is making sure you've got a decent house with a big backyard. That's not everyone's idea of success. And why are we saying, oh well, you should work hard and do this and do that? It's like the system hasn't worked. It hasn't worked for so long. The life expectancy is vastly different between Indigenous Australians and non-Indigenous Australians. The preventable healthcare in Australia accounts for 38%. What is it? No, sorry, 38% of disease in Australia is preventable. Yep. And I think it's closer to 50% for our Indigenous population.
Yeah, wow. That's massive.
Literally every stat you look at, it's vastly different. So something isn't working, and I think as Australians we do have an opportunity in the near future to change that conversation, and give them more of a voice to try and figure out what's going on. Things aren't working the way that they should, and healthcare is just one aspect of it. They're 3% of our population, but I mean they used to be 100% of the Australian continent population. So
an important part of the Australian population too.
Yeah. So it's a good discussion to have, and I think that we need to continue to have that discussion to be informed and make an informed choice.
Yeah. Very conscious. It can go like very spiraled from there and talking all the little, nuts and bolts of it all.
Yeah.
But no, it's super interesting.
Yeah, definitely.
Yeah, and maybe like this is probably a good segue now out of a little bit of this discussion about meeting in the middle between top and bottom. But talking a little bit about some of your stuff that you're doing in the background, away from your role with the New South Wales Health, some of the My Health Pledge stuff that you've recently started up, which has been awesome to see.
Yeah.
I went and got my skin checked, which was my little My Health Pledge not long ago, and it was just something that, again, like I personally have never thought of doing before.
Oh, it's great. Even as a healthcare practitioner, it's 100%. Like things that going to the dentist, I was like, I don't really think about doing that.
Yeah, exactly. So, My Health Pledge has been in the back of my brain for probably close to 7 years, maybe more.
I guess for our listeners, could you explain what My Health Pledge is? Sorry.
Yeah. So My Health Pledge is a social enterprise to challenge individuals, community members, families, workplaces, all to take their own personal health a little bit more seriously.
Mm-hmm.
And it's not just necessarily, it's trying to reframe what we think health is. And a lot of us look at health as like, you know, when we see a person, we look at them and judge their health, and you can be completely healthy and still have underlying health conditions inside, or potentially be at risk of certain cancers and things like that. And when we make those assumptions, we don't go and get checked. We're like, oh, well, I should be pretty good. Or we look at our older generation and they only ever go to the doctor when something's wrong. And it might be, you know, it's potentially too late at those stages. And so this was all born from, like, as I said, it's been in my brain for way too long, and I've finally been able to shape what it is now. And then that's come from a place of, you know, understanding the public healthcare system, understanding where the issues are in that, understanding that individual health literacy isn't great, and then how do we merge like the healthcare system and individuals to say, let's talk a little bit more in the middle here, where people don't understand what the Medicare levy is. They don't understand, you know, if I'm from England and I live in Australia, like, am I covered for this? Like, what's ambulance cover? Like, all this sort of stuff. So it's just having these chats around the healthcare system to bring people together and then challenge them to go and do things that they say, you know, oh, I haven't been to the dentist in, I don't know, 5 years. I haven't gone to go and get a skin check. So
It's great. It's
Yeah.
such a great initiative.
And
Yeah.
I think the more social healthcare become, like social's
Yeah.
thing with, the more digital healthcare becomes,
Yeah.
the more interactive like we are on that space and those platforms, the better. It's a bit of a dangerous space when you look at it, but I think there's so much benefit to, you know, creating a really healthy social kind of space where you can, you know, go out and have these conversations.
I remember when you first launched it as well, it was a bit exciting to see everyone making their different health pledges.
Yeah, I was like, I'm going to go and get my skin checked.
Yeah.
Yeah.
So, I mean, there's still issues with it, but it's like, it's something that I want to build where it doesn't matter if you're a dietitian or an osteo or whatever. Like, people can get around it, where I think that sometimes in the fitness and health space, people start arguing about like nuance in, say, a research article or this or that. If we can get 90% of the population moving in the same direction by going in to see a psychologist or going to book in to see a dietitian, we're moving in the right direction. And in terms of, like, I understand that there's barriers to that, and I want to try and figure out why and where they are. And as part of the health pledge, the answers that you provide is like, okay, well, what are the barriers, or what would you like to know more about the healthcare system? And then trying to feed off the back of that to say, okay, well, we're seeing trends in, you know, the Sutherland Shire region that we do not have access to an osteo. So let's have those discussions that we're, you know, to try and work at it from both ways, as you said, to try and figure out, because it's not just from a surface level. My health pledge is an individual health pledge. It's for the individual to go and make a free health, make a health pledge as a behaviour change, and then go and book into a doctor. Or if the funding is an issue, then make an easier version of the same thing. So as in a nutrition space, it's adding more veggies to your dinner, or it's going to see a dietitian. In a psychology space, it's 5 minutes more of meditation every day, or going to see a psychologist. Like, it's everyone's own. People can make it their own, and that's why I just wanted to create that discussion and these discussions more often with people, so that they're going to their family, you know, dinners or Christmases and going, oh, like, what did Nan die of? Like, you know what I mean? Like, what is our family history of health? Is it diabetes? Is it something else? And if you don't know, you don't know. And by being knowledgeable about your family history and things like that, you can be on top of things much earlier. Because Australians, I forget the stat. It's either 11. I think it's 11%. Or it's 11 years. We live our last 11 years of our life in poor health. And so chronic disease accounts for 90% of all deaths, and 38%, as I said before, 38% of all of that is preventable. So it's like we may be getting, like, we've got a pretty good life expectancy in Australia, but what's the point of passing away when you're 85 if for the last 11 years of that they were terrible? Why aren't we making changes now, so that in our 30s, 40s, 50s, when we're in our 70s, we can still move, we can still swing a golf club, we can still pick up our grandkids.
It's not like we're just, confined to the lounge.
Yeah, exactly.
Yeah.
So
No, it's really cool.
that's why it started.
I actually didn't
Yeah.
realize that you were collecting information to, guide policy and stuff. That's really
Yeah.
cool.
Well,
Yeah.
and it makes sense as well, right? Like you said, it just sparks that proactive nature in everyone and the conversation. So like if we can have those conversations with the healthcare system as well and meet on both ends, like it's a really nice.
Yeah.
Yeah, and I was just gonna say that like from coming from a nutrition perspective, and I kind of see online that like PTs and dietitians or nutritionists are kind of like, oh, well, you can't say that, you're not allowed to say that.
Oh, it becomes a pissing contest.
Exactly. It's just like, yes, there's scope of practice, and I fully agree. But what I would prefer to do is upskill people in the areas that they can give advice on, because they're at the coalface. They are the one. I'm not going to be seeing every single one of their clients.
Yes.
They're going to see clients back to back.
Yes.
And if they, as a PT, are informed and can have those brief nutrition chats within their scope of practice,
Yeah.
we're
not?
hitting more people
Exactly.
than saying, oh, well, I'm the expert in this field, you need to refer to me. Yes, you need referrals, but also
General health information shouldn't come at a premium.
exactly, and we need more people to understand the basics in all aspects of health.
Yeah. As a
yeah.
dietitian, definitely I get a little bit annoyed when, say, the PT gives out calorie advice and sort of real nichey, possibly harmful things.
There's definitely places they shouldn't be.
Yeah, but things like eat more fruits and veggies, great. Drink more water, awesome.
Yeah,
Yeah.
I think the hard part is with a lot of public health. Well, one area where it's really tricky is you don't see the outcome.
Yes.
Yeah.
You don't see a hospital admission
Yes.
if you've potentially prevented an illness or injury. And then I lost my second thought, but we'll come back to it. I'm sure it'll pop back up.
Yeah.
We'll keep going.
Yeah.
No, chill. Well, I was just going to say, how have you found the uptake of a lot of the My Health Pledge stuff just starting out? Because you're still pretty early days in the process of actually getting it out there and speaking to people about it a little bit.
With
Yeah.
saying that, I've seen you've been doing local organisations like gyms and things. It looks really great.
Yeah. So, I mean, there's a plan for it, and it's more than just the individual. It's around talking to organisations and potentially being in their space to be that middleman between any organisation and their staff, to say, how can we figure out a bit of a better work-life balance? We spend so much time at work.
Yep.
Reorientating the healthcare system to try and manoeuvre to suit individuals. There's plenty that is kind of happening, but I would say I've only launched at the start of this year, so it's been
You've been doing awesome.
it's been great so far. But I understand that it's pointless surrounding yourself with sycophants and people patting you on the back to say, oh, they're so good, and being on Instagram and stuff like that. That's not where I want to be.
Yeah.
I know that Instagram is a social media platform that's useful for health conscious people that are champions in their own space that can go out and utilize that.
Yeah, the people that want to see it will see it. But
Yeah.
it sounds like you want to hit the people that don't know about it.
Exactly. I want this eventually to be in the conversations in the homes of everyone's mum and dad.
Yeah.
To be like, mum, when's the last time that you got a skin check? Or dad, when's the last time you saw the doctor or went to a psychologist? Maybe
great.
never.
Yeah.
Maybe never.
Yeah.
But we need to have those discussions, especially with men and especially with older men, because it's never happened. These chats have never happened.
100%. I think of my dad and he'll be covered in some weird rash. I'm like, go to the doctor.
Yeah,
And he's
yeah.
like, nah, I'll be right.
Yeah,
I'm
yeah.
like, dude.
It'll go away.
Oh,
Yeah.
I'll just go to the pharmacy and get
It's like-
some skin ointment, then I'll rub it on there.
Oh, my heart or my chest hurts. I'm like, go
Yeah.
to the hospital. No,
Yeah.
I'm fine.
Yeah. So, but yeah, I mean, there's barriers. There's always barriers to that.
Yeah.
But prevention is better than a cure. So.
Absolutely, especially in the mental health space. And I'm well aware I'm more biased towards that because it's more in my sort of area of work. But I think preventable, it's harder to fix what's broken, right?
Yeah, definitely. And I think people see healthcare as expensive, and it is.
Yeah.
And I mean, Medicare needs to change, and it's currently under review. I just think that the voice is kind of taken over that space. Not that that's a bad thing, but politically they just need a bit of space to change Medicare.
Yes.
And so that's potentially, we're going to hear about that potentially next year, I'd say.
Yeah, cool.
But that needs to change. But
yeah.
in terms of healthcare itself, like if people think that it's expensive to go and see a doctor or a psychologist or get a skin check, that $80, might be expensive. You get some back. That gap is now terrible in terms of what you get back from Medicare. But that $80 and then the prevention off the back of that may save you thousands and thousands of dollars in healthcare later on down the track. So it's a hard pill to swallow to spend $80 on something like that, especially depending on where you're coming from.
Yeah.
But poor health is so expensive.
Yeah, even more with the GPs now I'm noticing. And look, hats off to them. I completely understand why they're doing it, but moving away from the bulk billing to private billing or mixed. And it's really hard for some people now to get access to just a doctor.
Yeah, 100%. I think like the bulk billing thing and the gap is what's the issue with Medicare at the moment.
Yeah.
And that's one of the biggest reforms. And I guess the discussions that we had, maybe even off air before, we're talking about that healthcare professionals being a bit more holistic and not necessarily referring on the doctor as the be end and end all, because and that's one of the references for Medicare to be better is leaning on allied health professionals and nurses to do a bit more in that space where they're more than capable of doing that.
Yeah.
And then letting doctors get on with the more severe things.
Yeah. Even
And
like
it is,
screen.
it's like-
Oh, sorry, you go.
I was just going to say, it is really like distributing a little bit of the load, because the GPs do get slammed. Like, I have so much respect for every GP. Like, they have to see every kind of different weird and wacky presentation in our healthcare industry.
And they've got 15 minutes to make a diagnosis and get that person out and the next person in.
Yeah, and I say to people, like, for me personally, as in allied health, it takes me 15 minutes to chew someone's ear off and actually get a little bit of an idea
what they're doing
as to what's going on
Yeah,
before I can actually like sit down and go, right, I need to go through my assessment and my treatment plan and like let alone in 15 minutes have a bit of a game plan.
Even on that note, like the whole eating disorder space, like I do screenings, but then I have to go, okay, now you got to go book in with your GP to get diagnosed, where all they're doing is taking them through a screening questionnaire, which I understand there's like a lot of more, detail and nuances to that, but it could be a good way to close, that gap a little bit.
And I think that is like, it's going to be an important thing in the future, is having healthcare practitioners that are able to take up that load and then take a little bit of health, like pressure off the healthcare system in general. Because again, it's just as expensive to go and see your doctor for 15 minutes as it is to go and see an osteopath for half an hour to 45 minutes. Like obviously the difference being that public health kind of Medicare gap relationship in terms of some of the funding, like where private, a lot of osteos and physios work in private practice, dietitians, private practice. So, that's a little bit of a trickier space to navigate in terms of funding. But like you said, it comes down to the fact where it's like, you can get a really good quality treatment, assessment, work out a bit of a management plan. And if that saves you thousands of dollars down the line, it can be worth it in the short,
No, exactly.
Yeah, and I think that like in terms of a society, and I always come back to this, you're always judged on the way that you treat your most vulnerable, right? So if you've got in certain systems where you go, oh, well, they're poor and old and on the street, like they're just lazy. Like that's not good enough. And we need what's called health equity, which is like, it's not giving everyone the same level of, say, handouts or opportunity. It's saying that this person actually has started from a much lower position that needs more of a boost to get up to a level of health that someone more fortunate or is born into a more affluent area is capable of doing. So that's what health equity is. And we should always have a lens of health equity when we're doing these sort of things. And I guess to a certain degree, the Australian healthcare system has tried to do that by introducing things like the Medicare levy, where after the age of 30, the government is trying to push people to get private health cover.
Right.
So the idea is that majority of Australians should be covered by Medicare.
Yep.
Even though it's the system isn't working that well at the moment.
Yeah.
Majority of Australians should be covered by Medicare, but more affluent people should be taking out private health.
Yes, to reduce the pressures.
To reduce the pressure
Yep.
on that healthcare system.
That's great.
And so that's the reason there are incentives or disincentives to push people towards that if we can.
Even the threshold thing with Medicare and how it is like, you know, sort of assessed person by person, I think it's really good.
Yeah. So I mean, there's areas where it works and it makes sense, but there's a reason that it's under reform at the moment.
Yes, definitely.
And obviously those discussions later on down the line will like take part with the private health insurance companies in the mix too, because it's almost like what we were talking about before. They need to also come into that conversation, make things, you know, and they don't have to, but, you know, it would help if they made things really affordable for people, because private health insurance is expensive.
Yeah, it is.
But, you know, like it is one of those things where it's an important thing to have, like you say, you know, and if it has a role in dispersing and helping some of the people who aren't able to access those services, then fantastic. But I think, you know, like to our point before, it's important that then we see them come into the conversation with, you know, the big government organisations that are going through it.
The big dogs.
The hard thing is money talks.
Oh, yeah.
You know,
Oh, yeah.
Private health, even the way that government funding or state funding, like it's just
so tricky.
It's
So many
hard.
moving parts.
It's hard sometimes, and
Sounds like a headache sometimes.
Yeah.
Oh.
I think it's like understanding that the healthcare system overall is a very slow moving beast.
Yes.
And that things aren't going to, like, I mean, we had to move quick for COVID, like during COVID times. But when people are like, oh, why isn't this happening right now? And you're like, bro, there's like so many people, like how many million people in Australia that we need on board at the same time.
Yeah.
We need time to get the right message out, a clear message out. Like,
It's not an overnight thing.
yeah, so COVID was a great example of that. But for everything else, like that was very acute.
Sorry.
For every other health issue, it takes
So
Ages.
time. So
And as
Yeah.
well, because people don't make big change or don't push for big change until they see something coming up through the ranks, you know, and it speaks to that real, that almost Band-Aid like effect where it's like, right, the symptoms, like even in the healthcare industry, you know, symptoms start to come through the woodwork,
yeah.
and then all of a sudden they're like, right, we need to, you know, we're finally got the
100%.
stats.
That's
that
how
we
you
need
get
to roll
funding.
with.
Yeah, that's how you get funding. It's,
Yeah.
you know, you could be screaming till you're blue in the face to say this is on its way. We can see it.
Yeah.
But yeah, often things get funding based on they're like, oh, that's a big issue. Like, let's try and shut that down a bit, which it's not a great way to be.
Nah, I can understand for someone as passionate as you clearly are in the like public health space, I should say. I almost said private health then. It would be quite frustrating at times to see how slow moving it is.
Yeah.
But also with that, I guess having a good understanding of the policy and what's involved, it would hopefully help.
I think when you look at if you want to make small changes individually, like you can have discussions and conversations and try and meet people where they are.
Yeah.
If you want to make large change to population based,
It's a long game.
it's a long game. You got to say that like we're going to write this policy that we know is good and is has good structures, good bones, and in 4, 5, 6 years time, people are going to see the ramifications of that. The perfect example of that is plain packaging. Plain packaging did really well
Yeah.
in terms of reducing smoking rates.
Yep.
And I mean, I think it's still something like 14% of Australians smoke. I think that stat is still based on cigarettes.
Yeah. Be interesting to see what they do with the vapes now
Yeah.
moving forward.
Yeah, so I've got a bit of a hand in what's called Kids Quit. So we've just revamped Kids Quit for the Sydney Children's Hospital Network, where that'll be rolled out to help clinicians understand the laws around what vaping is. What kind of marketing sits around it. Just a good understanding of vaping and the percentages of people that are doing it. and it's a fascinating space. It's arguably one of the best rebrands in history from cigarette companies going, oh, well, these are disgusting and they smell, and you know our sales are going through the floor.
Yeah.
Suddenly you've got like
Bubblegum flavored.
cool colors, cool flavors.
Yeah.
And everyone's, you know, out on a weekend going, oh, I wouldn't mind trying that at least.
Conniving.
Yeah. And then I think it's 60%. They did the study to show that 60% of vapes that said that they had no nicotine contained some form of nicotine in them. So they are addictive as well.
Yeah, wow. I guess moving away from the My Health Pledge stuff, what have you noticed in terms of trends popping up in the public health space?
Oh, I think vaping's the biggest one. Teachers are crying out for help. They're seeing kids that are smoking in bathrooms, and then potentially when they're getting caught, flushing them down toilets and things like that. Like it's an issue.
Yeah.
It's a proper issue, and because they're so small and they don't smell as crazy as cigarettes do, they're
hard to pick up on
as well. So I'd say vaping's our next big challenge, but we've learnt a lot from the tobacco history, yeah. And we can see this wave, and we're kind of a couple of steps ahead.
Okay.
Not that it's not going to be an issue.
Yeah, but it's having that prior knowledge of how that industry kind of progressed, and then being able
a really good example of like how policy can work is like if like Australia at the moment is talking about regulating imports of like just absolute whatever products in terms of vaping, if we can regulate that a little bit more to say you can only have X, Y, and Z color and flavor, and they can only be from reputable sources or whatever. We're not having all these vapes coming in onshore from every corner of the internet,
being sold in every corner store,
and exactly, and potentially that drops rates straight away because people don't have the access to just readily available cheap vapes.
So, that's awesome.
Mate, super wild. We've covered a lot.
I know. I feel like we could talk for hours about this.
I know. I was about to say, I feel like we need to come back here and have a few beers and just really break a lot down.
Yeah.
Like, as someone who only did like one subject, I think, on public health at uni, and it was quite like, you know, by the book. It wasn't very colourful or interesting, but just talking to you and hearing all the different things that actually go on, it's really cool.
Yeah. It's good to have these chats, and the more we can have these chats with family and friends, the better off. I mean, don't be that guy at the barbecue.
What are you doing?
Grandma, do you know what's in that?
Yeah, you gotta pick your time and your place.
Yeah. No, I think, and it's so good, like you said, to find out about a lot of this stuff, because to be honest, mate, like I think a lot of us see healthcare through the eyes, and like even as allied healthcare practitioners, like we see it through the private sector really clearly, but I personally feel like I've never known this much about the public health sector and the challenges that kind of you guys face. Like we see it in dribs and drabs through like the Medicare system and things like that.
I feel like we cop the brunt of it in the fact of like people coming in and being like, okay, just fix me. And it's like, well, no, I actually want to, you know, work on long-term behavior change so you don't have to, you know, come back in here.
Yeah.
So
that's my goal.
That's such a big issue where we go, we expect everything to be fixed within a half an hour session. It's like you need like diet and lifestyle are always going to be here. So we may as well choose something that's going to work for us long term. And if that takes a year to do a bit of trial and error with a healthcare professional, that's completely fine. Like let's do that rather than going, let's turn up and expect have wild expectations of this healthcare professional to be like, fix me now.
12 months of chronic pain and gone.
And gone within half an hour.
Yeah, I tell
meal plan to lose 10 kilos. I'm like, this is not how it goes.
Friday.
Yeah. And I tell my patient, I'm like, you know, if I could make that change in like one session,
I'd do it.
I'd be rich.
Yeah.
I'd be rich. Yeah. I wouldn't need to charge, you know, any money. I'd be, you know, we'd figured out the life hack. Everyone would be healthy. I'd be actually probably not rich. I'd be going out of business, to be honest.
That's why I say to my clients, I'm like, if my job was just about food, I probably wouldn't have a job. I'm like, it's behavior. Like, yes, definitely about food, but it's behavior change.
Behavior change is huge. But I think if we can, I think for anyone in the healthcare space that if you can set people's expectations early.
Yeah.
Yeah.
And I think one thing that I usually use is I get them to have some ownership early on to say, what would you like? What does success look for you
Yeah.
when we're done in 3 sessions time, in 3 months, 6 months time? What success look like for you?
Yeah.
And am I capable of doing that? Because if your idea of success is being pain-free by the end of this session,
Probably
like,
not
listen,
gonna.
I need to bring your expectations back, because we're not going to get there.
Yeah.
I can tell you that.
Yeah.
Yeah.
What we can do is work on this now. You might feel like, one less pain point this week, but we're moving in the right direction. So
Yeah.
I think any healthcare professional needs to set up expectations, because otherwise they're like, oh, that healthcare professional, they suck. And
They were shit.
that doesn't work. I'm not going to physio ever again. This is like, that's not the way we need to look at it.
Even with psychology, I feel like that's a massive one. The amount of times I've heard people be like, oh, I just went in and talked. I didn't really get much from it. I'm like, they're not going to fix your depression overnight.
Yeah, within an hour.
Yeah.
Yeah, and it's important as well, right, for like everyone to be on the bandwagon and helping each other out. And if there's something that I think you can't manage, like as a healthcare practitioner, you get the patient to the place where
100%,
because it's so important. Like multidisciplinary care these days is becoming so important. You know,
Yeah.
there's so much that goes into someone's pain or health presentation in general. It's not just as easy as there's a structure there that's dysfunctional, or it's got they've got a tear or something. We got to fix that. It's like, all right, how's their stress? Like, what else are we managing around that actual structural change?
Yeah.
Or has that come on from something completely unrelated or something in a different space? So I think multidisciplinary care in that sense as well is going to be so important moving forward.
Yeah, and that's one thing that I kind of want to eventually do with my health pledge as well, is there's something called like human libraries. That's where it's not where you go and pick up books, obviously. It's literally where you've got an osteo sitting in that corner, a dietitian sitting in that corner. You've got a range of different people. You've got a big group there. You have an introduction, and then say, listen, these people are human libraries.
Yeah.
Go and talk to them. And then literally like to say, talk to me about this, but you're probably better going over there.
Yeah.
It would be great for people to be able to bounce off healthcare
It
professionals.
saves people time and money.
Exactly. So that kind of, and I mean, you're only ever going to get top level stuff. You're not going to get into the weeds with that sort of approach, but that's kind of showing people, okay, well, I do need to talk to a few different people, get the right people in my corner.
Yeah.
And then moving forward in 5-10 years time, I've got a really good physio. I've got a really good dietitian. I've got a really good psychologist.
Yeah.
I touch base when I need to.
I've got the team and they're there if I need. Yeah. That's awesome.
No, mate, that's unreal.
I feel like we've covered so much.
That was good. We have covered heaps. I think we pretty much ticked majority of this
boxes.
stuff.
Yeah.
Which is good.
Sponsors will be happy.
I know.
Yeah,
We had
absolutely.
a big run sheet. I was a bit nervous that we weren't going to get through it all.
No, it's good. And mate, plenty of time to get over to the
There you go.
To
Let's
the
do
Berg.
it.
The Berg.
Yeah, down the Berg.
I guess
No.
for our listeners, like, where can people find you, or a little bit more about My Health Pledge and that sort of stuff?
Yeah, My Health Pledge is pretty straightforward. It's literally myhealthpledge.com.au.
Yep.
For anyone that's listening, go and make a health pledge. It's so easy.
It's kind of fun.
It's literally like a 2-minute process. You'll obviously need to book your own session. If you are planning on booking something after that, like a psychologist, dietitian, skin check,
Yep.
you need to make your own booking after that. But the idea eventually is to merge those things so that people don't need to look so far.
Yeah, cool.
But yeah, go and make a My Health Pledge. Obviously all on socials as well, and I'm on socials under Chapo. So if people have more questions, I mean, more than happy. I love having these chats. So.
Actually, one thing I didn't mention is your memes at the moment on your Instagram.
Oh, yeah.
they're
They
going
are
off.
amazing.
Oh.
I like cackle every time I see one. I'm like,
yeah.
oh my God. It's very good.
Yeah, I do. I don't know. I just enjoy making them, and I think that they're funny. And I'm
They're
like,
hilarious.
if anyone else does, then that's good too. But it's like you kind of need that. That's what social media is. It's pointless sitting there going, "Oh, I'll listen to this." And
You can be
this-
the most knowledgeable person
exactly.
in
You
the world.
need to convey it.
Yeah,
you need to convey that right. And humor always works. Humor's
100%.
good. So
And last thing, mate, have you got a goal time for this coming Sunday?
Oh,
'Cause at the time of
yeah.
filming, we're coming up to City Mara, and
Yeah.
and you're looking quick. So
yeah, week out. So
Gosh.
no comment. Nah,
TBC.
We'll see you out there. We'll see you out there.
Smash it,
I'll talk to you at the finish line.
Yeah. Talk to you over a couple of beers after.
100%. Yeah.
Awesome. Thanks for coming on, mate.
Yeah,
Thanks,
thank
team.
you.
Appreciate it.
See you soon.
Alrighty, adios.
Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at we don't know yet.pod.
See ya.